Hi everybody, it's Dr. Magnifico from Jarrettsville Vet and Probably.com. This is Stripes. He is a domestic short hair rescue cat. He's about 7 years old and he has had this snorting sound. So it sounds like he's snoring. Hi, sweetie. He's just been sedated and we're looking for a polyp in the back of his mouth. So he went to another veterinarian with snorting and they took an x-ray and couldn't find anything in his chest. And then they wanted to refer him to a specialist to see if there was a polyp in the back of his throat, and they gave an estimate that was very expensive. And here is the hard palate, here's a soft palate, and then right back here there is a rather firm mass. So I'm gonna see if you can get all the way in there. Can you see it? So we are going to remove the polyp by avulsing it, which is pulling it out. Okay, Peter, get down in there. So this is the soft palate, and then right back there is the polyp hanging out. You see it? So it looks like a big kind of red cherry in the back of the throat, and that's why he's snoring. So I'm going to intubate him, and then we're going to put him under anesthesia, and then I'm going to remove that polyp. For some reason, the referring veterinarian wanted to send him to a specialist. I think a specialist gave them an estimate of about $1,500, which was cost prohibitive for them. So he came here, and we are going to do it for about $130. So it's a big difference between $1,500 and $130. The cost of anesthesia is $100, so that's really where the cost of this comes in. You know, I don't typically do it with just sedation. I do put them under anesthesia just in case there's any bleeding or anything else that we need to address. So he is going under anesthesia, and then we will take the polyp out. Now, the classic presentation for these guys is they sound like they're snoring even when they're awake, and it's when you listen to their chest, you hear what's called a referred upper respiratory sound. So the noise is all in their head, and polyp is one of the places that you should look first. In most cases, it's pretty easy and pretty simple. So if your cat has this chronic persistent snoring sound, usually I say do a sedated exam. Usually I just say sedate and take it out, like do it all in one fell swoop, because it's not worth coming back for. I need hemostats too. Ready? So this is like the one place where you need like 12 extra hands. You don't always have it. Okay, so we're going to try to keep all of this down here. I know. Okay, Laura, you're gonna have to hold the bottom jaw in this. In the tube, yeah. Okay. And then ideally you want to get it all in hemostats in one fell swoop, and then pull it out. And that's it. That was sitting in the back of his mouth. He was not able to breathe, and the estimate for this at the specialist was about $1,500. And it takes all of a couple minutes to take out. So now we just watch for bleeding, because we've had that problem before. Make sure that there's not excessive bleeding going back there, and you also want to make sure that there's nothing else. Let me get some